Hello, I'm Kenneth. I'm a pharmacist. If you have been told that you have high blood pressure and you are giving amlodipine, lisinopril, or losartan, and you are wondering, what will this drug be doing in my body? This video is for you. In the next 20 minutes, I'll be explaining what these drugs does to your body in a simple English and removing every medical jargon. At the end of this video, you will understand the side effects to watch out for and how to take the medication safely. If you find this video interesting at the end of the day, kindly subscribe and share with someone who is currently taking high blood pressure medications. So let's dive straight into it. Now, think of your blood vessels as a guardian hose. Blood pressure is actually the force of blood that is pushing on the wall of that host. When the host is narrow and tight, the blood pressure becomes high, and that is what is called hypertension. But when the host is relaxed and wide, and the blood pressure comes down. I'm going to explain 3 ways medication works in order to bring down the blood pressure. Now, all BP medications do one thing. First, they relax the host, or they reduce the amount of water in the host. And they do that in 3 different mechanisms. For instance, this is amlodipine, popular brands called Novask. They are called calcium channel blockers. Calciums are what requires for the walls of your blood vessels to squeeze tight. Amlodipine stops calcium from entering into the walls of the blood vessels, thereby making the blood vessel to relax, enlarge and open up, and thereby leading to the drop in your blood pressure. You will notice when you are using amlodipine that it works smoothly and slowly within 24 hours. Common side effects include ankle swelling. You probably notice your ankle swelling is one of the most common side effects. You also notice pulling of the legs, blood pooling at the legs, and which is not actually dangerous. So when you notice it and it becomes something of concern, always consult your doctor. Another one is flushing or headache, which happens within the first week of usage. Then another side effect you could also experience is dizziness, and that's why it is advised when using amlodipine that when you are standing up, you stand up slowly in order for you to be able to manage the symptoms. What do you need to do? First of all, you need to take your amlodipine every day, with or without food. Second, you need to avoid taking your amlodipine medications with grapefruit juice, because this could actually increase the level of the drug in your system. Thirdly, you don't have to stop your medication because of the ankle swelling. Always ensure that you consult your pharmacist or your physician in order to reduce the dose that you are currently taking. Then, what is amlodipine actually very good for? It is also usually the first line of antihypertensive medication, and it's very appropriate for patients that are having chest pain. Next is lisinopril. Lisinopril is an angiotensin converting enzyme inhibitor. In your system, we have a system that is called RAS. RAAS. It's called renin angiotensin aldosterone system. Pardon me, I promise I will remove all medical jargons. But this is very important because the RAS system actually helps to relax the blood vessels and remove excess fluid from the blood. And how does it do this? It simply works by stopping the enzyme that is responsible from making or causing this vessel to become contracted and also reducing excess fluid from the blood rather. So it is very good for patients with diabetes and kidney diseases. What are the common side effects you can find? Number one is dry cough, sticky cough that makes you uncomfortable. And this is one of the major reasons why sometimes your pharmacist or your medical practitioner may decide to substitute lisinopril. Number two side effect is dizziness, which especially if you decide to stand up abruptly. Then another one is that it can have the potential of increasing excess potassium in your system. So what do you need to do? Very important, you don't take lisinopril while you are pregnant. Number two, you don't take lisinopril with potassium containing salt, and you don't combine lisinopril with ibuprofen often because it can cause kidney damage. It also has to be taken the same time every day, with or without food. Lisinopril is very good because it helps in patients with hypertension that also have diabetes, heart failure, or heart attack. So then the next is losartan. It's known as the angiotensin receptor blocker. Losartan works similarly like lisinopril. If you remember the rat system we talked about, they work in similar fashion. But unlike lisinopril, losartan does not cause intractable cough, those kind of dry cough that keeps you coughing through the night. So whenever you can't tolerate lisinopril, your doctor or your pharmacist usually recommend that you can. Now, what are the common side effects? Of course, common side effects include dizziness, high potassium content, and tiredness. What are the similar warnings? Number one, losartan should not be taken when you are pregnant. It should not be taken concurrently with ibuprofen at all times. Number three, you have to take it once daily, with or without food, the same time every day. Who is it good for? Just like lisinopril, it is good for patients with hypertensive patients that also have kidney-related issues, and it is also good for patients that are having other heart-related issues. Importantly, don't stop the medication without consulting your pharmacist or your healthcare provider, and always ensure that you take your drugs, monitor your blood pressure, and ensure you stick to this solution provided. Thanks and bye for now.